One company called Phonak has come out with, or basically taken that binaural processing to the next level. They have a technology called StereoZoom and AutoZoom. And what they are is it's a manual program, meaning it's a button press. It's not automatic, although it has automatic capabilities. But when you get into the StereoZoom program, what it does is it uses that binaural processing to integrate information from 4 microphones, 2 on one ear and 2 on the other, and it allows us to beam or to focus more on who we're looking at. So a normal directional hearing aid, if you look at this picture, has kind of a wider directionality and it reduces sound behind us on both sides. When you manually press this button, it focuses on who you're looking at. And the reason it's manual is you don't always want to just hear directly in front of you because you're trying to hear multiple conversations. AutoZoom is another manual setting that is used primarily in travel situations where speech is on one side and people or the voices are on the side or the back. Okay, so when you're driving, if you had a device like this, you might go into this AutoZoom program, and what it'll do is it'll focus on the voices to the right and to the back and also send them over your head wirelessly to the opposite ear so that you have a better shot of hearing those people in the car or plane or train. High frequency compression or frequency transposition technology is something that's relatively new, and this helps us send high frequency information to people with dead regions in their ears. So there's some people who have good bass, but their hearing drops so far in the high frequencies that there's no usable hearing left. So with these people, 10 years ago, what we used to do is we'd crank as much volume as possible into that high frequency area thinking, well, if we give them anything, that'll help. And what we found out is everyone complained that they heard worse with their hearing aids than without them in that case. So what this technology does is it actually takes the high frequency range that the person can't hear and it either transposes or compresses it into a lower frequency so that we have a shot of hearing the TH and the S and the F even though we have no hair cells in that area. All right, the next, number 7, technology is Bluetooth connectivity. And this is getting more popular. It's been out a few years. You'll see people with these. And this greatly enhances one's ability to hear the television and cell phone, not just louder, but clearer. So a lot of people complain that when they wear hearing aids, they do pretty well in general, but they have a hard time hearing dialogue on movies. Okay? And part of the reason is that they're sitting 15, 20 feet away from their TV. They have high ceilings, tile floors, windows everywhere, and so acoustically it's very poor. So just turning up the TV or even wearing hearing aids doesn't get the job done. So with a device like this, you actually have something like this, okay, which is a Bluetooth receiver that if you were wearing the hearing aids, you just put around your neck. And then you have a box like this that's plugged into the TV. And what this allows us to do is to go anywhere in the room within 40 or 50 feet, and the TV will be directly in our ears at all times. Okay, similar to the way TV ears work. The advantage of this is that with TV ears, you have to take your hearing aids out and put your TV ears on, and you can't hear your spouse. In this case, you can still hear your wife, if that's an advantage. Some people have said it's not. Now this also allows you to hear the cell phone as well, so you can link wirelessly to a cell phone. So if my cell phone were in my bag right now and I had this around my neck and I was wearing 2 of these hearing aids, I'd be able to answer the phone with a press of this button and it would send the phone to both ears. Okay? The limitations of this are that it's available in small over-the-ear devices and larger in-the-ear devices, but you can't get this technology to fit in a small, completely in the canal type device. Number 8 technology is hearing loops. If anybody reads New York Times, you may have read an article about this maybe 2 months ago. And this makes new use of an old technology. For 40 years now, hearing aids have had the capability to have what we call telecoils, or a button press that allows us to hold the phone above our ear in a certain position, and the hearing aid will pick up magnetic energy right off the phone, not whistle. And these had some advantages, although they were very difficult to use. But what we're finding now is a lot of places, not a lot, but there's places that are looping rooms. So for example, this room could have a wire surrounding it that's a magnetic coil or a magnetic loop. And then it could be connected to my microphone, so that anybody who walks in here with a telecoil would be able to press a button and my voice would be directly in their ears no matter where they're sitting in this room. What's great about it is it's universal. So you could have a hearing aid that's 20 years old that has a T-coil in it, or one that you just got 2 months ago. And if you are in an equipped area, you would be able to use this technology. Now the problem with it is, once again, it's only available in small over the ears and bigger in the ears. And currently, loop facilities are few and far between. There's none in the valley that I know of. Okay, LA Airport has some of their counters looped. Subways in New York. In Europe, this has taken off. Every taxi cab in London has a loop system in the back so that people who have hearing aids can use the loop. And you'll know if it has it by seeing this little symbol right here. So in conclusion, if you're considering hearing aids, start the process with an open mind, go in positive, compare professionals and not offers and technology. So make sure that you're not comparing Phonak with Starkey, it gets too confusing. Compare the professional you're going to be working with. Be suspicious of any special limited time offers. There are no special limited time offers, okay? I always tell people I can give you a 90% discount if I raise my prices 90%. If you ever feel pressured to purchase a device, walk away. So at any point, if you feel like you're getting pushed and you're not ready, go ahead and leave. And then maintain realistic expectations. Don't expect perfection, especially early on. When you first get hearing aids, it takes time, it takes some patience. Stay positive when trying them, and if the negatives outweigh the positives, by all means, return the hearing aids during the trial period. So don't put anything in a drawer. If it's not working out, you tried, give it back. It should be 100% refundable. Okay? So we're going to hand this off to Dr.